Proteomics International is a specialised medical technology company working in the fast-growing area of personalised medicine. We focus on curing disease by developing new diagnostic tests, using completely new ideas to come up with new ways of looking for disease. At Proteomics International, we analyse proteins. You'll have heard about DNA and genes. The genes that we're born with are the genes that we die with, so they don't change during our life. What changes over time are our proteins. And if you think about the caterpillar and the butterfly, if you just did a genetic test, it would tell you that they are the same. What changes during the organism's lifespan is the proteins that it makes. It's the same in humans. As we get sick, we make different proteins. We don't make enough of the right protein, we make too much of the wrong one. But by measuring these proteins, we're able to predict very early on where we're heading and then intervene and come up with new therapies. We have our own novel platform technology that lets us develop these tests. We call it Promarker, and the first test that we've developed with it is Promarker D for diabetic kidney disease. There are 2 million people in Australia with diabetes. Approximately a third of the adults with diabetes have chronic kidney disease. But there's a subset of those diabetics, about 10%, 200,000 people, that's twice the capacity of the MCG, who are going to have a significant and rapid decline in their kidney function in the next couple of years towards dialysis, kidney transplant, or worse. They're walking around today, they know they're sick, they've got diabetes, but they don't know that their kidneys are going to be failing. And with Promarker D, we can intervene much sooner in the process and stop people progressing towards this debilitating disease. Promarker D is a simple blood test. In its most straightforward form, it's a protein fingerprint, if you will. We can go and take a simple blood sample, and that can be tested in the pathology lab using standard equipment that's already available today and used for a whole range of other tests. One of the questions we get asked is, can we actually make a difference? There is a reality that we can all stop ourselves having diabetes or going down that path. However, we are in a society where we do want quicker fixes. What we hope is by coming up with a test like ours, that's an extra incentive to encourage people to make a change sooner and stop themselves going down that path. We're getting lots of interest in terms of commercialising this test. We have a manufacturing agreement in place to make the kit in China. We have a lot of interest out of the US in terms of bringing this forward as a specialist test, and places like the Mayo Clinic. Most recently, we've done a commercialisation deal in Central America. This is very exciting for us because it really opens the door to bringing this test in to the sophisticated markets of the United States. We have a number of patents which have already been granted for Promarker D. We've also got patents pending in all the major jurisdictions. What we're also able to do is provide an internet-based analysis system where the results that are collected by the reference pathology labs around the world can be piped to us in Perth, where we'll be able to use our algorithms, our software, to analyse the data and just feed a result back, and they can then report that to their patients. This is an emerging field. The area broadly is called personalised medicine. It's forecast to be worth $45 billion in the next 5 years, doubling from its current size. We are one of only 4 companies in the world who work in this area of biomarker discovery and new diagnostics. We are different from many biotechnology companies. Not only do we have the potential revenue from the licensing deals which have already started, but we have a contract services business. This has been funding the company since we started in 2001. It's allowed us to invest several $1 million of our own money into building our technology platform, into generating and creating new tests like Promarker D.